Now, live from Whitney Media, 1460 WVOX, the Greenberg Report, with Greenberg Town Supervisor Paul Feiner. You can join in the conversation at 914-636-0110. Now on 1460 WVOX, here's Greenberg Town Supervisor Paul Feiner.
Hi, I'm Paul Feiner. I'm the Greenberg Town Supervisor. A couple months ago, I was speaking to somebody whose mother was living at an assisted living facility, and she was paying over $20,000 a month for the care. The mother was in failing health, and it dawned on me something should be done about the high cost of assisted living facilities. Most start at $7,000 or $8,000 a month and quickly escalate if you have a loved one, $10,000, $12,000, $15,000 a month. So I sent out a blast on the town email list, and Laurie Racanelli responded. And she said she wants to participate in the committee. And she and the committee have been doing wonderful things. We've had a lot of meetings, and I'm so pleased that you're a guest today.
Thank you, Paul. I'm happy to be here and very excited to be part of the committee.
And Laurie, maybe you could just tell us a little bit about yourself and about your company, Caring People.
Sure. So I've been working with the geriatric population for over 15 years in various roles. Most recently have acquired a position with Caring People as a home care consultant. And sorry, somebody just interrupted us. So basically I am a consultant, and I assist people who are looking for services for their family member in their home, not only to put services in place, but to also connect them with other resources in the area as well to help with that.
So your role as a home care consultant is to advise, to help them analyze, to read the contracts, I guess?
Absolutely. So, as part of Caring People, we provide the contract itself for home care services. So we're able to examine the needs of the elderly person in their home and help the family to figure out what the best solutions are for their current situation.
Will you provide them with consumer tips as well?
Absolutely. Yes. And I know you're very focused on the affordability, which I think is great. I have recently been introduced to a website called genworth.com, which actually offers consumers a cost of care calculator for what they may need in their home, which is a very interesting tool and recommended for figuring out the cost of home care.
How would somebody find you when they're looking for home care? And do you recommend that anyone looking into assisted living or in-house care consult with a consultant before they make a decision?
Absolutely. So the way they would find us is by going to our website, which is caringpeopleinc.com, or they can also email me at laurie.racanelli@caringpeopleinc.com.
And your company is based in the Bronx, but it serves the whole region.
Yes. So we are currently focused in the New York City area, but also Lower Westchester. So anywhere along 287 and south are most feasible for us. And also we service New York City, we service Long Island, we have offices in Connecticut, New Jersey, and Florida as well.
That's great. When is the right time to inquire or seek home care services?
So the right time would be after a hospitalization or any change in your elderly family member's circumstances. If somebody's coming out of the hospital and has a change in condition, that's a critical time. However, there's other times when somebody may be going through something, if there's a death of a spouse, that person may need some help with meal prep, safety and supervision, ambulation assistance, or even just companionship we can help with.
There's somebody who's a member of our committee, Kevin Swersey, and he keeps saying to me, I shouldn't just focus on affordability, I should focus also on safety. And
Yes.
is that an issue that you focus on?
Absolutely. You want the person to be safe. Every client who comes on to service with our company is immediately visited by a nurse on our team. The nurse will go into the house and also do a safety assessment to make sure the person is safe in their home. We always want to put in enough care and enough interventions so that to keep the person safe.
Great. We have to take a break, and then we'll be right back. And my guest is Laurie Racanelli, and she's a home care consultant with Caring People. And the office number of Caring People is 718-425-4620. And what's the website?
The website, again, is www.caringpeopleinc.com.
We're going to talk about assisted living facilities and making it more affordable, and what our committee is doing when we get back. This is a really important issue, and it's sort of one of these issues that a lot of elected officials haven't focused on yet, but hopefully after our committee gets started, everybody will be talking about
Absolutely. Yes.
it. I'm Paul Feiner, Greenberg Town Supervisor.
1460 WVOX.
Now back to the Greenberg Report on 1460 WVOX. Once again, here's Greenberg Town Supervisor Paul Feiner.
Hi, I'm Paul Feiner. I'm the Greenberg Town Supervisor, and I'm really pleased because today we have as our guest Laurie Racanelli, and she's with an organization called Caring People. They're home care consultants. She's been very instrumental in helping us come up with proposals dealing with making home care more affordable, because it's so expensive, especially assisted living, and we want to make this available to the middle class and people who can't afford $15,000, $20,000 a month in costs. I had a question in terms of why would someone choose home care as opposed to other options? Is it cheaper to be cared at home than in an assisted living facility?
Well, if a person needs the maximum amount of care, the cost could actually be equatable to an assisted living. However, sometimes a person does not need that maximum amount of care. So at that point, it does allow a person to then extend the amount of time in their home. It helps the families to manage their own costs, customize their services, and also to basically sort of put in the services they need at the times that they need it. So when you ask if it's a lower cost, it can be if a person only needs 5 to 8 hours a day of care. It can definitely save on that larger rent that an assisted living would require.
Do you feel that, I guess for some people, the nice thing about an assisted living is if they're healthy enough, there's activities, entertainment. Sometimes they take them on trips.
Yes.
But a lot of the people, by the time they go there, it's too late for them to really enjoy all the amenities.
Yes, and I mean, all of that is true, and I think there are different options as far as being the assisted livings versus being using a home care agency. With a home care agency, the one thing that we can do to promote the socialization and prevent isolation is that our home health aides can escort the clients to, let's say, their senior center, different activities or groups. We recently had one person who wanted to keep going to her book club, so we were able to put in a home health aide that would escort her to her book club, basically. But yes, assisted living does encompass all of those services under their umbrella as well.
And in terms of the costs associated, any thoughts on that?
The cost associated with
Just
home care,
home
or
care, and
assisted
also
living?
the services that you provide.
Right. So what I find to be the most useful with home care is that, like I said, you can manage the cost yourself by putting in the care that's needed at the time it's needed.
Right. We were talking before. Is it expensive to hire a consultant, by the way?
So my consultation is free. It's complimentary as part of the program at Caring People. So if anybody needed to sit down and just have a conversation with me, that is absolutely complimentary.
That's fantastic.
Yep.
So basically, you're like a consultant, and then Caring People does like the.
So Caring People would come in then if it's the appropriate amount, if it's the appropriate match, that so that somebody can talk to me, and if we analyze the situation and assess the person in their home, and we find out that it's a perfect match for them to have home care, then we can go ahead and put services in place.
Do many other home care agencies have consultants?
Well, not that I'm aware of. I think there are different roles in different home care agencies. A lot of home care agencies just operate out of their office. So the advantage of having a consultant is that you have somebody in the field that's able to go visit a patient in the hospital or visit a patient in their home and have that one-to-one conversation.
Yeah, it was interesting because at our meeting a few days ago, somebody mentioned that they went to an assisted living and the rates kept going up like because they're now regulated. And it went, they might have started out at 10,000 and then it's a 6% increase every year. Do you feel that the government should regulate assisted living?
Well,
like rent control?
I think that it's a state by state regulation already. So it's already being regulated in states like New Jersey, Washington, Oregon.
But not New York.
Not New York. So I think that it's definitely something that can be implemented and should be implemented to mirror the services that are already existing in other states.
So the progressive wing of the Democratic Party would probably love you because this is something that really should be focused on. And again, if the local governments couldn't regulate, but the state could.
Absolutely, yes. I think that it's definitely something with the baby boomer generation that we need to take a look at, and especially with the assisted livings that are being built in Greenburgh itself. Let's take a look at how they can best service the snapshot of the population in Greenburgh and New York.
Or until there's regulation, sometimes if you meet with an assisted living facility provider, you could say, these are the rates. This is going to be the rate increases for, say, a 5-year period of time, and they may commit to keep the rate increases at a certain level. Isn't that a possibility during the negotiations?
I think that is a possibility that can be included in the proposal that we've been working on as a committee. Absolutely.
That is great. In terms of the committee, could you just tell us a little bit about the committee that you've been involved in, the Geriatric Care Affordability Coalition, and what's your impression so far?
Well, it's interesting how it grew, Paul, is that, as you said earlier, you put a blast out on social media. I responded to it. It was going to be a meeting with yourself and you, maybe 2 other people and myself. Right. So, I'm really enjoying it. I feel like I've taken on a leadership role in the committee, which is great. And I think the main thing that we're learning, and we're learning as we're going, is that this is about options, and it's about not only affordability, but it's not a black and white between the wealthier demographic who can afford the assisted living and the clients that are automatically eligible for, let's say, Medicaid services, which would cover in certain times. So there's like that gray area of the general population who can best be served by providing different options. So what's coming forth with the committee is that how can we implement options that the assisted livings can put in place so that the diversity of the demographic can afford assisted living.
That's great. We have to take a break, and my guest is Laurie Racanelli, home care consultant for Caring People, and her office phone number is 718-425-4620. Again, 718-425-4620. And he's an expert on home care and assisted living facilities. And again, if you're spending a lot of money, you might as well do it correctly and know what the pitfalls are before you make the investment. So I'm Paul Feiner, Greenburgh Town Supervisor.
Better yet, download the WVOX app and take us with you wherever you go.
1460 WVOX.
Now back to the Greenberg Report on 1460 WVOX. Once again, here's Greenberg Town Supervisor Paul Feiner.
Hi, this is Paul Feiner. I'm Greenberg Town Supervisor, and we're talking with Laurie Racanelli, who's a home care consultant for caring people. Phone number 718-425-4620. And the reason why I invited Laurie to be my guest on the show today is because she's very involved in a committee we formed that's promoting affordability, making assisted living, more, affordable. And I feel she's extremely knowledgeable. During the break, I asked you, there's somebody I know, and her mother was in assisted living in Westchester and was paying like $20,000. And
Right.
I thought that you said that you thought that the average is about $12,000. Why do you think her monthly rates was over $20,000?
Okay, so a lot of the times, assisted living licensures vary, and oftentimes they cannot handle a level of acuity that a person or a family member may have when they're at the assisted living. When somebody's shopping around for their assisted living for their parent, the parent may be able to ambulate, maybe socializing on her own, and then may have an incident and a decline where you can't predict the future and you don't know what kind of care your parent may need in a year or two after they are moved into the assisted living. At which point, depending on the assisted living licensure, the family might come to a cross in the road where the assisted living tells them you have to put on private care, one-to-one care for your parent, or essentially move them into a nursing home. So it could be the case, and I don't know exactly, but it could be the case for the person that told you they were paying $22,000 that they were actually putting on private duty home care as an additional cost to the family in the assisted living.
Great. We've come up with some recommendations, really options. And one option is, to have for the town to mandate that assisted living facilities that are under consideration in the town choose from different package options and create affordability for 10% of their organization. The assisted living facility would have the autonomy to choose any way to implement their affordability program from one of various options. So why don't we discuss the various options? One is Medicaid spend down program. Residents would be admitted with an option to spend down their personal finances to pay for room, board, and care. These residents will be required to pay privately for a minimum of 2 years before applying to Medicaid. Could you explain that?
Sure. So this is what we have found is being done in other states, such as New Jersey. We have found this out just basically by asking around different programs and learning about different assisted livings. And this is a common model used in I think all of the assisted livings in New Jersey, because they make it a requirement for the assisted livings.
Now, New York doesn't allow that?
As far as I know, the assisted livings do not have any regulations implemented on them in order, to sort of force them to do it. I suppose they could do it if they wanted to, but I don't think assisted living developers are interested in doing that unless it's a requirement.
Right. So is New Jersey one of the only states that's doing this?
I think it's the closest state that's doing this. There may be some programs in Connecticut that are also implementing similar structures. The other state that I read about that's done it is Washington and Oregon.
Wow. Well, it's a really good initiative. I did speak to Andrea Stewart-Cousins, the state senator and majority leader of the Senate, and she's interested in this.
That's
great. So I
great.
think that this is an issue that we could really have a major impact. It's sort of nice when you feel that another state's doing something, because it makes it so much easier to get New York to do the same thing.
Yes, like we're not cracking the code here.
Right. And one of the initiatives our committee is going to do is have meetings with all the state legislators and hopefully we'll be able to expedite the enactment of some legislation.
That's great.
So you're going to get a taste in government that moves quickly, hopefully.
Absolutely. That's amazing.
The next issue that we're talking about is sliding scale rent and care. Residents who are not currently eligible for Medicaid will be admitted upon disclosure of their income to the facility, and the facility is to calculate a suitable room, board, and care amount based on the resident's income. Could you discuss that?
Sure. And I think this idea came up during the committee, modeled on, I don't know of any assisted livings that have done this, but many doctors' offices and clinics do similar sliding scale bases, such as there's Open Door, Sleepy Hollow, and Tarrytown. When you basically walk into an Open Door clinic, if you don't have insurance, they will collect your financial information and come up with a reasonable fee based on the services provided to accommodate what you can afford, basically.
That is, that is great. What do you think the chances are that this initiative could be seriously considered?
I think that sliding scale program would be a great option, especially for the people in that gray area that I mentioned before, people who do not have the funds to afford the highest rent available, and also have more funds that would prevent them to be eligible for Medicaid.
Another issue is implement the Medicaid ALP program. Could you explain what ALP stands for?
Sure, Paul. So ALP stands for simply Assisted Living Program. And that is something that we have also learned about on our committee. We have been visited, we have been fortunate to have a member of the Empire State Assisted Living organization on our committee as well. And she has been sharing with us her knowledge of the ALP program, which basically helps assisted livings to either be completely devoted to Medicaid funding or have a certain amount of their assisted living apartments to people who are on Medicaid. So just for an example, there is an assisted living in Yorktown that allots 10 of their apartments to Medicaid.
What's the name of that?
That is Yorktown Assisted Living.
Is there a big waiting list, for that?
I mean, I would say there's not necessarily. There could be at times a waiting list. I would definitely say they're full most of the time.
Right, because that's amazing that here there's an organization that does take, Medicaid,
Mm-hmm.
so there is some affordability.
Yeah.
Do you think that, the population of Westchester is definitely aging,
Mm-hmm.
and there's more baby boomers who are going to need this, but not everybody's going to be able to afford the care.
Mm-hmm.
Do you think the county should be building more affordable, facilities? Years ago at Grasslands, they built the nursing home, and is it time for the legislature to actually be more proactive?
Mm-hmm. I think that assisted livings are great. I think that they serve the population. I also think that we need to come up with a way for the assisted livings to meet the diverse demographic. So, I tend to favor a model such as the one in Yorktown, where they allot a certain amount of beds for lower income rather than being a full low income building.
Now, we were talking during the break, and you said that maybe one of the reasons why it hasn't been a big issue in New York so far is the people who live there could afford it, and it's sort of elitism a little bit.
It could be. I mean, it seems to have been the people who can afford assisted living are proud that
They live there.
that they live there and can afford it and don't have to go to a Medicaid funded nursing home or what have you.
Right. We are going to be right back in a couple minutes. We just have to take one more break with Laurie Racanelli with Caring People, and she's a home care consultant. Her phone number is 718-425-4620, and your website
is caringpeopleinc.com.
Good on. Paul Feiner, Greenberg Town Supervisor.
WVOX.
Now back to the Greenberg Report on 1460 WVOX. Once again, here's Greenberg Town Supervisor Paul Feiner.
Hi, I'm Paul Feiner, Greenberg Town Supervisor, and I'm really pleased. We have a really interesting, program. My guest is Laurie Racanelli, a home care consultant, and her office is with Caring People. 718-425-4620 is the phone number, and they give advice and help people make the right decisions relating to senior care. We have this affordable geriatric care affordability coalition that you've been very instrumental in helping to lead. Actually, you're really the leader because you come up with all the ideas. But I wanted to mention that we also have the Empire State Association of Assisted Living, and we have representatives of the assisted living facilities at these meetings. Some people may say, if you're advocating for affordability, why bring in and include the people who you're complaining about? I mean, is it? Do you feel that the fact that we've included representatives of the committee has been helpful?
Absolutely. So, we've had developers sit with us during the committee meetings from the various assisted livings that are growing right now in Greenberg. I think that, to be quite honest, Paul, I think that this is not as much of a surprise as we had originally imagined for some of the developers. I think that because it is happening in other states, that they have already sort of thought out these sort of what we thought would be a surprise to them. They have already thought out these other affordable options. Interestingly enough, one of the developers themselves came up with an idea of having the assisted livings contribute to an affordability fund, which would basically provide a sponsorship for some of our Greenberg residents to live in their buildings.
Right. So this is an idea that they came up with rather than our committee, the people who are critical came up. They said whenever an assisted living facility is built, I believe that a certain amount would have to be put into a fund that could be used for any affordability, and it could generate $400,000 or $500,000 that could help the town make affordable options available to some of our residents, which is a good idea.
Yes.
These ideas have to be tweaked. It's also interesting that the developers and the assisted living facilities, they've been bringing their lawyers to our meetings. So obviously they're taking it very, very serious. And I sort of feel that we're really under the radar. Most of the media hasn't really picked up on what we're doing, but obviously they're taking it seriously because every time a lawyer shows up, they probably charge their clients thousands of dollars. Now, your organization, Caring People, you have a very interesting initiative where there's 8 hours of care for $99.
Yes.
Can you tell us about that?
Sure. So basically, the Caring People has come up with this program to implement for anybody who's being discharged from a hospital or physical therapy rehabilitation, who's going home. And the service is designed to bridge the gap before any services normally get to the patient's house. So a lot of the times if a client has Medicare as their primary insurance, they are discharged home with Medicare Homecare. However, oftentimes that Medicare Homecare does not begin until 48 hours after the person arrives home. What our Safe and Sound program, which is $99, includes is an escort home from the rehab or hospital for the elderly person or patient. At that point, we will as I said, escort them home, get them settled into their house, and also provide a complimentary nurse visit for our nurse to review any medications, make sure that is in place. They will do things like checking their vital signs, and the transition from going from the hospital to home is a big thing, and we're there to make sure it goes smoothly.
That's great. The Empire State Association of Assisted Living, they've talked about a project called ESAAL, and it's the assisted living program that the state's started, but it really is just starting to take off, and it's competitive. Do you have any information about that? Well, basically, this is a program where there's some beds that would voluntarily be more
Right.
affordable.
So that's actually the ALP program that we were discussing before.
Right.
So the ALP program is the program that comes, it's basically been originated by this Empire State Association of Assisted Living.
And basically, what we would have to do is, if Greenberg is looking at more for assisted living, we would want the developers to try participating in this program, because I
Yes.
think it's a limited program, and it's not for the state doesn't have enough beds for. It's not making it
Yes.
available for everybody.
So according to the representative who has been coming from ESAL, is that it is an application process that the assisted livings have to go through in order to qualify for the ALP program. So there are requirements set forth by the Department of Health that enable assisted livings to apply. So basically, the main requirement is that the current ALP programs in our state have to be, or our county have to be at 85% occupancy.
That is great. Could you tell us a little bit how we just have like another 2 minutes? How your agency was founded?
Sure. So Caring People, which is, I think, the best feature of our company, was started in 1998 by Hannah Schulman. Hannah was seeking assistance for her mother-in-law, and she implemented an employment agency to assist with all of the domestic needs, from nannies to cleaning ladies and senior care. Her grandson is now the CEO, which makes it unique as a family-oriented and founded company. At some point, the company identified the opportunity to promote senior services and focus on the senior population. They became a licensed agency in New York in 2001 and eventually expanded to New Jersey, Florida, and Connecticut as well.
What made you go into this field?
Well, I've been in geriatrics, as I said, for 15 years. I love every aspect of it. So when I was presented with the opportunity to go into home care as something that would be new for me, I jumped at it, because I've worked in assisted living, I've worked in skilled nursings. So putting home care in as a piece for me was advantageous.
Did you study this field in school?
Yeah, so I originally had my bachelor's degree in creative writing and studio art, and after working in skilled nursing using those skills, I went back to school for my master's in public administration and health service management. So I've studied extensively policies and procedures applicable to the field.
For students who are looking for a field, home care, and this whole field is a good field because the population is getting older.
Absolutely, yes. And
So there's jobs.
there's a huge growing field of servicing the patients in their home. You know, we just spoke last week. We had a speaker for our company from Mount Sinai who educated us about the hospital at home program that Mount Sinai offers, where they go into patients' home and treat the patients right there.
That is great. I just want to mention that if people are listening and they would like to be part of our committee, they could email me at pfeiner, F-E-I-N-E-R, at greenbergny.com, or they could call me on my cell 438-1343, or at the office 989-1545, because we'd love to have you involved. And thank you so much, Laurie Racanelli, who is with a home care consultant, for being a guest. And also I want to thank you for doing an amazing job as really one of the top leaders of our affordable committee. So if we make some headway, I'd say it's 99% because of you. But obviously, if I run for re-election, I'll say it's 100% because of me.
Of course. I'm
thanks.
enjoying it. Thank you,
Thanks a lot.
Paul.